Okay, so now I'm going to give everyone on the panel a chance to introduce themselves. Also, Dr. Lauren Sandrecker is going to be joining us in about 10 minutes. She had to see a patient, which we know is our priority here at Valleywide, so she will be joining us as soon as she can. So I'm going to start with Dr. Steinberg. If you could introduce yourself and tell us why you're interested in sharing this education with the team.
Hi, I'm Chris Steinberg, and I'm one of the family physicians. I work at Alamosa Family Medical Center. And I'm honored to be included on this panel because I'm excited and about getting past the pandemic, and I think the vaccine has a very key role to play here, and I want to help answer any questions our folks might have.
Thank you, Dr. Steinberg. Justin, if you could introduce yourself.
I'm Justin Hann. I'm one of the pharmacy co-directors. I'm sure you guys are all getting tired of hearing from me or all my emails, but I think we're getting close. It's going to be exciting over the next few months as we vaccinate all our patients.
Thank you, Justin. Cathy.
Good afternoon, everybody. I'm Cathy Pacheelli. I do the infection control safety program for Valleywide, and I'm really excited that we were one of the CHCs that first got the COVID vaccine, and we got that for our area. We've been able to administer that to our staff. We've started with the 70 plus people, and I think this is a good time to look at the turnaround for the pandemic that's happened. Thank you.
Thank you, Cathy. Darcy.
Hello, I am Darcy Martinez, the Director of Nursing, and I am just here to really be an advocate for the nurses. They've been on the front lines for a really long time, and they've got the brunt of it and have been handling it with grace and rigor for such a long time, and I just want them to have one more tool or one more defense in this fight.
Thank you, Darcy. Emmeline.
Hello, I'm Emily Martinez. I'm the Chief Medical Officer. I'm really excited of what Valleywide has accomplished thus far to provide access to our patients, and as more of our staff is getting vaccinated, how we can continue to do business and be available to our patients and to keep our staff safe.
Thank you, Emily. And Alifonso.
Good afternoon, Valleywide. I'm Alifonso Barros. I'm the Director of Human Resources, and I'm excited to participate today and hopefully provide some information to some of your HR-related questions.
Excellent. Well, thank you all. So I am going to start with the first question, and it will be directed to one of the panelists to start with, but then any of you can add information after that first person answers. And so this first one is going to go to Justin. Justin, it feels like the vaccine arrived very quickly. How do we know that the COVID vaccine is safe, and has it had enough testing?
Sure. So the U.S. vaccine safety system works to make sure that all vaccines are as safe as possible. Safety has been the top priority as federal agencies work with the vaccine manufacturers to develop and authorize the COVID-19 vaccine. All the vaccines go through clinical trials to test the safety and effectiveness. For the COVID-19 vaccine, the FDA set up rigorous standards for the vaccine developers to meet. So far, none of the vaccine trials have reported any serious safety concerns. Trials for the two vaccines from Pfizer and Moderna have fully independent safety monitoring boards, and safety data are continuously reviewed by the FDA and the expert panels. So when we look at, so it was done really quick, right? So why is that? Well, in the past, the vaccines have taken many years to develop. However, relatively quick development of this vaccine does not mean that safety measures were skipped. There are several reasons why the vaccines were developed faster than other vaccines. The type of the vaccine developed for the Moderna and Pfizer vaccine has been in development for years for other infectious viruses. So this means that the manufacturing process was ready very early in the pandemic. China shared the genetic information about the coronavirus when it was available, which gave vaccine developers an early start at finding a vaccine. The testing process for the vaccines didn't skip any steps, but the vaccine developers did conduct some of the stages of the process simultaneously to gather as much data as quickly as possible. Governments like the United States gave money to the vaccine developers in advance so that the companies had the resources they needed. The vaccines were created using relatively newer technology called mRNA, messenger RNA, and it allows for a faster approach than the traditional ways vaccines are made. Social media enabled companies to reach out and enroll study volunteers, and plenty of people wanted to help. So there was enough research participants to get to test the vaccines. Because the coronavirus is so contagious and widespread, many volunteers who got the vaccine were exposed to the virus. And with so many exposures, the trials took a shorter time to see if the vaccine worked. And finally, companies began manufacturing vaccines ahead of their authorization or approvals, so some of the supplies would be ready once authorization occurred.
Great, thank you, Justin. Sorry about that. Thank you, Justin. And I know Darcy wanted to add something to that. So Darcy.
No, I couldn't agree more. I think that some of the groundwork was already laid many, many years back when they started coming across MERS and SARS and some other infectious diseases, viral diseases, and some of the other stuff in HIV with the mRNA had already been in progress. So, you know, to take some of that science done ahead of time and to really augment it, I think helped do that. So thank you, Justin.
Thank you. Any other panelists would like to add anything? Okay, we're going on to the next question. This one is for Dr. Steinberg. Can you talk a little bit about how the mRNA vaccine works?
So all vaccines work when you're exposed to a protein that your immune system then can respond to by developing antibodies. The mRNA vaccine basically exposes you to mRNA that is a messenger for creating the COVID virus. It cannot do so in your body. All it can do is alert your immune system that it is to make antibodies against this part of the virus. To make a very important point, this is not a whole virus, it's just a piece of it. And it can't be, you can't get sick from, you can't catch COVID from it. It is just a template, an inactive template that wakes up your immune system to proteins on the COVID virus.
Thank you, Dr. Steinberg. Would anyone else like to add to that? Okay, this next question also goes to our medical team. So we can start with Dr. Steinberg again, and then Emmeline or anyone else if you would like to join in. Why should I get vaccinated instead of taking my chances with COVID? Is herd immunity really a thing, and can I still get COVID after I get vaccinated? And if you want to address the carrier piece too that came up in the chat, that would be appropriate at this time.
Okay, so the first question is, say it again. Let's take them in order. What was the first part of the four-part question?
Sure. Why should I get vaccinated instead of taking my chances with COVID?
So the reason to get vaccinated is because when you get vaccinated, you develop immunity without consequences. If you get exposed to COVID, presuming that you're going to develop immunity after you get sick with COVID, there is a chance that you will be very, very ill, and probably more importantly, there's definite probability that you will pass it on to other people. And when we pass it on to other people, statistically speaking, some of those people will die. So you may not get sick, or you may not be seriously sick, but because it is so contagious, the very fact that you are a vector, meaning you can pass something along once you have the virus, means that you are participating in other people's serious illness and possible death. So we're part of a community. You can say, well, great, I don't care, I'll get COVID and I'll get through it. It's not an individual, it shouldn't be an individual decision. Next part.
The next part was, is herd immunity a thing?
Herd immunity is a thing. It's not a very helpful thing when it comes to COVID because a proportion of people who get sick with COVID in order to participate in herd immunity will be disabled or die. it takes something like 80% of immunity to have herd immunity. And even though it seems like this pandemic is moving very quickly, it would take us years to get to herd immunity at great cost to society if we waited for natural herd immunity. Now, when you think about it, if we vaccinate 80% of people, you've got a form of herd immunity. And yes, indeed, it is a thing. It's a positive thing when you think about it from the standpoint of vaccination.
Thank you. And then
Can I add one point to what Dr. Steinberg said?
absolutely.
Okay, so when we get this is Lauren Sandrecker, I'm wearing a mask, I'm in a space with some other people. When we have a virus naturally, the immune response that our body makes is actually somewhat inconsistent. So some people will be protected for a short amount of time and other people will be protected for a longer amount of time based on different levels of immunity, whether it's what's called innate or adaptive, different types of immune response. And one benefit of a vaccine for immunity over actually naturally having the virus is that the vaccine teaches our body to have an acute or like natural innate immune system response in the moment, but it also teaches us to create memory B cells that create antibodies against the COVID virus over time. So the immunity from a virus is less predictable and less accountable in the long term than the immunity that one can get from a vaccine. And that's one of the reasons why it's so much hoped for that more people will get the vaccine so that we can get to the levels of 80% or so of the population vaccinated, not just having the virus that Dr. Steinberg was saying.
Thank you very much. And then can I still get COVID after I get vaccinated?
Yes, you can, probably. We don't know. This is new. We don't know whether this is going to be a recurring theme like influenza. So only time will tell. Right now, we're trying to nail the acute problem, but we don't have answers about whether we will have long-term immunity. Not because the vaccine doesn't work against the present COVID virus that's circulating, but we know about viruses. They do mutate over time, and we don't know if they will mutate enough to dodge our present immune response to the vaccine, which gets to the question about the variant virus that's been found in UK. I'm sure one of the questions is going to be, does the present vaccine protect me against the newest mutation that they've identified? And the answer is probably.
Okay. And then the same would be true, probably we don't know enough yet about being a carrier. That would be something that we would continue to have to monitor based on this, recent administration, correct?
So the understanding is that after we're vaccinated, after we get our second shot, and then another week goes by, we are protected from getting sick from COVID. The question is, can we get an asymptomatic carrier state by being exposed to someone who's sick and passed it on to someone else? And until everyone is vaccinated, we will need to continue to wear masks, particularly those of us in healthcare, because we're exposed to so many people. So getting the vaccine is not just a way to avoid wearing a mask. We still have that responsibility going forward, probably for a long time.
Great. Thank you, Dr. Steinberg. Would any of our other panelists like to add to anything that Dr. Steinberg gave to us? Okay, excellent. So then the next question is kind of about the variant strain of COVID. So Dr. Steinberg actually answered that. So if I have already had COVID and have recovered, do I need a vaccine? And this one, it goes to Darcy.
Yeah, due to the severe risks of complications from getting COVID, we think that we should, even if you have COVID, you should still get the vaccine. Dr. Sandrecker just talked about her natural immunity versus the vaccination immunity. And natural immunity versus the immunity you get from the vaccine. So with natural immunity, it varies person to person, and that's why we think the immunity offered from the vaccine would still benefit people who've already had COVID disease or COVID illness. Let's see. And we just don't know how long the natural immunity is going to last. And so we're still recommending it.
Great. Any additional information from our panelists?
And we also don't know if you'll get COVID again to the same degree. So you could still get reinfected with COVID. We have heard of cases where people have gotten the disease twice, and we don't know what that second exposure looks like or that second process looks like.
Can I just add something about the new strain of COVID that's been in the news lately? And it was I think it was first discovered in Colorado. So even though we do know that it's more contagious, but we don't have any evidence that it's any more lethal. So we don't, again, as we've said, we think the vaccines might help protect us against the new strain. We don't have any evidence that it doesn't. But if we are, it's more, maybe not more lethal to us, but if we're spreading it around more, it is more lethal to people who are at risk for severe illness. The other thing I heard a professor from the university say is, even if you have mild symptoms initially with COVID, it doesn't always predict how sick you're going to get eventually. So you have to, again, and this is another reason to take the vaccine, is because you don't really know how personally you're going to experience the severity of the illness. So just wanted to add that.
Thank you, Emmeline, very much for that. Any other additional information from the panelists on those questions? Okay. This next question is directed to Cathy. Can I get the vaccine if I am currently diagnosed with COVID-19 and pulling from our chat discussion, recently diagnosed with COVID-19?
So if you are currently diagnosed and have active COVID-19, you really must wait until you've recovered and meet the CDC's guidelines for when you can stop isolating. Plus, once you're recovered, current evidence suggests that you're not likely to get infected again within the 90 days after initial infection. So we want to have you delay your vaccination as you're nearing the end of that period. And part of that is, I've heard, if I've been exposed to COVID-19 and I'm on quarantine. So if you're currently on quarantine, we want you to wait so that you can avoid potentially exposing others.
Great. Thank you very much.
I can add to that as well. So there wouldn't be any adverse effects if you got it before that 3 months. It's just kind of saying, well, you're already protected, then let's save that vaccine for somebody who hasn't been exposed, and let's get it to somebody that needs the protection right away.
Thank you. Any other additional information from the panel? Okay. So the next question is kind of going to the safety of the vaccine for certain populations. This one is directed to Dr. Steinberg again, but anyone can answer after her. Is it safe to be vaccinated if I am pregnant, breastfeeding, or planning to become pregnant soon?
Yes. Oh, absolutely. And I think the question comes up because with vaccines that are developed in a non-emergency setting, each population is studied. And in this case, pregnant women were not studied during the vaccine trials. However, the American College of Obstetrics and Gynecologists and the American Academy of Pediatrics addressing the unborn child both say that your advantage of getting the vaccine far outweighs any risk, and we have not seen any problems subsequent to vaccination of pregnant women, lactating women, or women planning to get pregnant. So we strongly recommend it.
Great. Any other additions? Dr. Sandrecker saying thumbs up. Anyone else?
The other special population that came up in the chat questions was people who are actively fighting cancer at this time. And unless specifically recommended by their oncologist not to do so, and that's not happening much. We recommend that people who are struggling with serious illnesses have a very strong reason to be vaccinated.
Okay. And how about with autoimmune disorders?
That as well.
And with autoimmune disorders, you might be taking medications that affect your immunity. And so the vaccine just might not work as well for those individuals. There's no harm in receiving it, it just might not work as well.
Thank you.
And when you are receiving chemotherapy drugs, sometimes there's a cycle that you go through, which is your high and your low. So working with your own provider to see when's the best time for you to get that.
Thank you. And I think that would be our recommendation for all of our staff. Everyone, work with your providers if there are questions you have, and really have that discussion one-on-one with your medical team. Would that be accurate, team? Okay.
Yes.
So the next question is, has anyone died from the vaccine, and who is it not indicated for? And this one is directed to Cathy, but again, all of us can jump in after that.
So I know rumors have gone that a couple of people died, but the facts are, no, they didn't die from the COVID vaccine. One person was scheduled to get it, but didn't get it and had died. But there have been no recorded deaths on the COVID vaccine. Right now, they say don't vaccinate if you have a history of an allergic or anaphylactic reaction to any of the component of the COVID-19. And since it's a newer vaccine, we haven't given a lot out. But if you've had a history of a severe allergic or anaphylactic reaction to another vaccine, then once again, you're advised to talk to your healthcare provider, assess your risk, and look at delaying it.
I do want to add to that, Cathy, that many people have had anaphylactic reactions, and this has come up in the public health administration pods and the hospital pod. If you have allergies to foods, medication allergies, history of anaphylactic reaction to a bee sting, you will be screened for those things and observed longer. But you are strongly recommended to receive the vaccine, and you're in good hands when you get the vaccine done, because there are emergency personnel who can reverse the anaphylactic process. And you don't want anybody to avoid the vaccine unnecessarily for allergy issues.
And when we're
basically saying is if you're allergic to the COVID vaccine, don't get the COVID vaccine. Well, nobody's allergic to it yet. Go ahead.
Exactly.
And when we're screening, we are asking those questions. And if you have anaphylactic to injectable or a vaccine, they're recommending that we just monitor you for 30 minutes instead of 15 minutes. And of course, we have EpiPens available.
Thank you. Any additional comments, team? Okay. So what is this one goes to Justin. What is VSafe, and do I have to sign up for it? And does this mean the government will be able to track me?
So VSafe is totally voluntary. It's a smartphone-based tool that uses text messaging and web surveys to provide personalized health check-ins after you receive the COVID-19 vaccination. Through the VSafe, you can quickly tell the CDC if you have any side effects after getting the vaccine. And depending on your answers, someone from the CDC may call you to check on you and get more information. VSafe will remind you to get your second vaccine as well, if you need one. During the first week after you get your vaccine, the VSafe will send you a text message each day to ask you how you're doing. And I know these can be a little annoying after a week. And then you'll get one once a week for up to 5 weeks. And then the VSafe asks, they usually take about less than 5 minutes to answer. They're really fast. And then after your second dose, they'll provide a new 6-week check-in process. And then finally, you'll get check-ins at 3, 6, and 12 months. So this is all new. The CDC wants to follow everybody and see how everybody's doing and gather the data. Your personal information in VSafe is protected, so that it stays confidential and private.
Thank you. Any additional information from the panel on VSafe?
I signed up for VSafe. It's a text message, like Justin just said. It is less harmful than all sorts of other spam text messages and things I get. And took me 30 seconds every time to answer my symptoms after the vaccine. And I feel like I'm contributing to research, and that's a good thing.
Thank you, Dr. Sandrecker. Any additional information? Okay, so this one is going to go to Dr. Sandrecker to start. What are the side effects of the vaccine?
Okay, there are a lot of common side effects that have been reported in really actually only about 5 to 10% of people that get the Moderna vaccine, and that's the one that's been offered to us. They may be malaise, a low-grade fever. I've seen reported in the hundreds, but really never higher than like a true fever of like 100 or 101. Malaise, sometimes people have some body aches, or headache. Those things are not common. I had the vaccine 2 weeks ago and I did not have any of those things. And I know some other young people that had the vaccine, as well as some middle-aged people had the vaccine and did not have symptoms. I think it's a odd distribution on who gets them. Interestingly, older people have the incidence of side effects less. And I encourage people not to be worried about side effects like that, because they really are a sign of our immune system creating a response, in the same way as we tell parents that after getting some vaccines, their children may have some fussiness or a low-grade fever because their immune system is revving up. Another interesting side effect of this vaccine that a lot of people note is some injection site discomfort. I felt that was my one side effect from the vaccine, and it was totally tolerable with ibuprofen and time. So.
Thank you. Any additional information from the panel about side effects?
Some of the reports I've received from staff is they have had a mild headache, the muscle pain. I had one person that had nausea and vomiting, but other than that, as Dr. Sano said, it's the normal, the pain, especially swelling on the arm it was given. So taking ibuprofen, making sure we do cold packs, there are things we can do.
Thank you. Any additional information? So this one goes to Darcy to start. What if I forget the second dose? What happens?
Yeah, speaking of second doses, not a big deal. I mean, we really want you to get it at your, either was it your 21-day or your 28-day mark, because the science has said it's most effective at that interval. But if you miss a couple of days, they're not sure what the efficacy decreases, how much it decreases. So as soon as you remember, as soon as you could get in for that second shot, don't worry, you don't have to start the series over. You just get it as soon as possible. And that's what kind of everybody's saying right now, because we're coming upon that second wave of getting your injections. In the future, there are some vaccines and trials where it's only one injection, but I think that's still far away. So the CDC has said, just get in as soon as you can. It's not a huge deal.
Any additional information, panel?
And I know we don't have it figured out quite yet on how we're gonna do that for patients, have them come in for the second injection, but we're actively working on that, and that should be available very soon. So be reassured that it's in progress.
Thank you very much. The next question will be directed to Dr. Sandrecker to start, but I'm thinking you all may have something to add about this. Can we stop wearing masks and social distance if most people get a vaccine?
Will most people like in society, or most people in Valleywide, or?
So you can take it however you want, but let's start with Valleywide and then go global after that.
So it would be nice if we could be like the NBA and have a cocoon, and like we all are vaccinated and we don't have to wear masks at work. But I think that because we have people coming in, our patients and people coming from the outside, I don't think we can stop masking and social distancing, unfortunately. There will be a time that we can do it less, but that's not here yet. But I think that we can, I'm looking forward to continue wearing masks, continuing to distance, but feeling like there's less residual risk that I'm still undergoing and that my patients are still undergoing. And so I do not think we can stop. There will be a time, though, that our society, I truly believe, has at least 80% of people vaccinated, and we will be able to back off some of these measures because the virus will just be less common.
Thank you, Dr. Sandrecker. Would anyone else like to add to that? So I know we are it is hard to stay social distance. It's hard not to have in-person meetings. It's hard not to be face-to-face. We have to continue to be vigilant based on all of the things that Dr. Sandrecker and all of the panel has talked about. And so I know that that is tough from both a behavioral health standpoint as well as just a personal connection standpoint. So, you know, we can still do this, but the more that we support each other in it, and the easier it will be as we move forward. I am going to go back to the chat questions. The first one is, are there any ages or populations that should not get vaccinated? And if so, why?
So the Moderna vaccine has been, the test population was age 18 and above, and the Pfizer vaccine was age 16 and above. So we're not opening up the vaccines to children until there's approval for those. I'm sure there are going to be exceptions, just like with pregnant women, where the benefit outweighs the risk, and there may be children with respiratory diseases, and we'll have to go ahead at some point to go ahead with the actual present vaccines. But for now, listeners' children will not be presently vaccinated until further notice.
Any additional information from the panel? Okay. So we'll be offering, can you let us know when VWHS will be offering the public vaccines in our region? So we talked about that. As we continue to get vaccines from the state, we will be rolling that plan out our communities as we go. And I know that each of the county's public health departments may have received vaccines and are doing their own clinics as well. So check with your local county public health departments in addition to what we're doing at Valleywide. But do we have any idea, like for people who aren't in the high risk category, when we think this will be available to the general public?
The latest that I've heard is hopefully we can move on to phase 2 by the end of February, if we can get through all of the phase 1. But it's going to take some time to get through everybody. It's this long process. If it was one vaccine, everything would be cut in half, but everybody needs 2. So it's just going to be a long process.
Thank you. Someone had asked about the free vaccine events. How will we ensure that the patient will receive their second dose of the vaccine? We will be holding second events as our plan right now. As we go through these processes, we may refine that, but we will know everyone that we gave the vaccine to. They also all get their own card that talks about the date they need to get their second vaccine. And so there will be some public outreach. There will be other community events that we are hosting, and then figuring out if we missed someone or they need to get in, how to catch them. But that's part of our planning process as we're going through these events. Any additional comments on that, team? Okay. This one, if you have the vaccine, will it affect any of the COVID testing, including the antibody antigen test, to see if a person has ever had it?
Well, I could speak to the rapid test because I've been reading its literature for months now, but it's an antigen test. So the vaccine helps you create antibody, not antigen. So, the rapid test would be just for antigen. I don't know the specifics about the PCR test yet, but I could say that for the rapid test, it wouldn't pick up anything.
Okay.
If you had the vaccine, unless you had COVID infection.
It would be the same for the other tests as well. It won't give any positives. With the if you compare it to like flu, some of the flu vaccines have a live virus contained in it, and some of those will give a false positive, but this doesn't carry any virus in it, so there shouldn't be any false positives with the test.
So let's go, I'll come back to the question before this one, but so that brings up the question, is the vaccine getting billed to medical insurance for patients?
So the vaccine itself is provided free. The supplies are all free. CMS does allow for an administration fee to be charged. For our employees, that wasn't processed. For patients, when we're having events and in the future in the clinics, those administration fees will be not billed to the patient. Of course, patients aren't charged anything, but those are collected on our cost reports.
Thank you. I appreciate that. Any other information anybody would like to add for that? Okay. And then do you all know if the researchers have mined the data on participants with various chronic illnesses? Has there been any kind of in-depth research on that?
I can answer that one too. So in the trials, all the individuals were considered healthy adults. So that's why it wasn't done in patients with chronic conditions, pregnancy. And so a lot of the information going forward, now that it's opening up to phase 4 and to the public, a lot of that information will be gathered now.
I am not seeing any more questions. We do have a few minutes left. Is there anything, anyone on the panel, I can give you each like a minute or two for closing remarks if you would like. I will call on you. Chris, would you like to add anything?
No, although I've got to say, I think we're living in a historical time, and I was absolutely delighted to be involved the minute the vaccine arrived in the building, and I hope to share my enthusiasm with everyone who's listening, because this may be the beginning of the end of the crisis if we all participate.
Thank you, Dr. Steinberg. Justin.
So the only thing I can add is this is all new to everyone, and we're still trying to figure out the process, and just ask for everybody's patience. And you know, if you have questions, reach out to us. We'll try to find the answer if we don't know.
I will come back to the panel, but I think a really important question just came up in the chat. It said, I've heard people state the vaccine alters our DNA. And I know that that came up with certain things. So would anyone like to address that, please? Dr. Sandrecker.
Oh, go ahead.
Oh,
Go ahead.
Chris, you want to go first? Okay. So the vaccine promotes our body making mRNA. So DNA is what our genome is what we were born with, is our chromosomes. mRNA is what our body translates from the DNA. And then that mRNA is like a transcript to then go make proteins. mRNA can't be turned back into DNA. So it only goes in one direction, and there's no way to take what the vaccine gives us and then transfer it back into our own DNA and find a place to insert in our own genome. So that is something I was interested in, because Dr. Steinberg brought that to my attention, that people had thought of that, and I looked into it, and that is not possible. It more is a transcript that tells our body to create a protein, but it like can't take a step back to go to take mRNA and turn it back into DNA, which is what our genome is made of. So I am not worried about that, and I would not be worried. And another interesting thought has to do with breastfeeding and pregnancy, that this mRNA can't live outside of -70 for very long, like long enough to basically do its job with our immune system. And so there's really no way it's going to transmit through breast milk or necessarily like all the distance across the placenta. So it just made me have more, less concern about those conditions. So Dr. Steinberg is going to say something else.
Okay. Emily, did you want to add anything?
No, I was just going to agree, not at such a technical level as Dr. Steinberg, but yeah, I agree.
Okay.
In a closing argument, though, not argument, but just a statement, I just want to say, when you're seeing your patients in clinic, bring up the vaccine. Don't wait for them to ask, because they're dying to talk about it. And unless you bring it up, just say, oh, so have you thought about taking the vaccine? Well, I'm not sure. I said, well, I took it and I did fine. And well, they say, well, do you think I should take it? Well, I think you should because you have this condition and this condition and this condition. And also, we will be contacted and mention to them that we will be reaching out to our patients to let them know when we're going to offer the vaccine. That way, they're just not out there wondering what we're doing. So again, look at every interaction with a patient as an opportunity to educate them, to engage them, to tell them that we're working on it and we'll be reaching out to them. We're not really sure how it looks yet, but we're definitely have a plan, or we're going to put a plan in place.
Great, thank you, Emmeline.
Yeah.
Darcy, for your closing remarks.
No, I'll just tag on to Emmeline and be just a strong advocate for patients to consider their risks and their benefits and come up with their own decisions. There is stuff we don't know yet, and that comes down to them making those decisions and balancing that out for themselves.
Thank you. Cathy, your closing remarks.
Okay, just want to thank everybody for, the masking and the good hand washing and making sure we're doing our social distancing. And as Chris said, this is a trying time. You haven't seen an outbreak since 1918. And I think that working together, we can all do well and we can learn and we just power on.
Thank you, Cathy. Alfonso, your closing remarks.
I just want to thank everybody for attending today and say, let's get vaccinated.
Thank you, Holly. Dr. Sandrecker.
I think something I bring up when I'm discussing this vaccine, or really any vaccine, or masking or distancing with patients, is just remembering that it's not really about me. These things are for our community. These things are ways that we care about other people. And so I feel like it's more in solidarity with those around me and those I want to protect that I do these measures, and I try to convey that to other people.
Thank you. And in our final closing, I just want to say thank you so much for everyone joining today. Thank you especially to our panel. I so appreciate you all being willing and able to participate and answer questions, both prepared and on the fly. So thank you for that. And we do know that all of our patients have the choice and the option, and we'll provide all information as possible. And thank you all so much for joining us today, and have a wonderful rest of your day. Thank you.